I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. Thank you, listeners, for joining me today as we continue our series on planetary health. In our last episode, Dr. Husein Moloo kicked things off by sharing his own personal leadership journey into planetary health, and he primed the pump by getting us thinking about the triple bottom line and how he's engaging others to move from a state of eco-anxiety to eco-action. It is not easy to influence a single individual to take action on anything, and while it is far from impossible, it can certainly be Herculean to get a whole health organization to take action on an issue. But unquestionably, when it comes to planetary health, that is exactly what's required. So yes, that is the focus of today's episode as we continue how you move a whole organization to take eco-action and the lessons others have learned along the way. To have that discussion, I'm very grateful to welcome all three co-chairs of Sunnybrook Health Science Center's Green Task Force, what will surely be an enriching panel conversation about Sunnybrook's exemplary leadership in this space and how other organizations may be inspired to do the same. Joining me today is Michael Lithgow, Manager of Energy Climate Action in the Plant Operations and Maintenance Department. He is a professional engineer, a certified energy manager, and a LEED accredited professional. He has worked over 30 years in energy efficiency and green buildings, but is particularly pleased to have helped bring diverse sustainability initiatives to Sunnybrook, including beehives, electric vehicle chargers, bike share, and cogeneration. Now, with the creation of this Green Task Force, Michael is eager to further collaborate with colleagues from across the organization to achieve even greater sustainability for Sunnybrook and the planet. Next, I'm pleased to introduce Dr. Susan Deering, the Division Lead for Long-Term Care in the Department of Family and Community Medicine at Sunnybrook. Susan is deeply concerned about the changes that we have been and will be experiencing as a result of climate change, particularly the impact on human health. As the health sector is a significant contributor to greenhouse gas emissions and waste, Susan feels strongly that we must act to reduce our contribution. She has been working with interprofessional teams to reduce the impact that comes from the certain types of inhaled medications within Sunnybrook communities. She is currently working on her Master of Public Health with a focus on the impact of climate change on human health. Susan is excited about the opportunity to be part of creating solutions at Sunnybrook and working together with other people who are also passionate about these issues. And last but not least, we're joined by Genny Ng, the Manager of Quality and Patient Safety. Genny has over 15 years of healthcare experience. Prior to joining the Quality and Patient Safety Department, Genny worked as a respiratory therapist in the ICU. In her current role, she oversees accreditation preparations and leads quality improvement initiatives aimed at enhancing patient care. Genny's passion for sustainability sparked when she read about the global decline in bee populations and their impact on future food security. This led her to bring beehives to Sunnybrook. So hi, Genny, Susan, and Michael. Welcome to the HQ, and thank you for sharing your leadership and Sunnybrook's work with all our listeners.
Thank you, Dale.
Hi, Dale. Thanks for having us.
So lots to share, but maybe we could just sort of provide maybe a brief introduction about beyond what I certainly shared at the outset here about, what started you on your own journeys, your own passions and interests in planetary health, and perhaps just help situate our listeners here as well. Maybe share a little bit more about who is Sunnybrook and where are you situated?
Yeah, so I'll start here. Hi, everyone. For those who don't know Sunnybrook is located in Toronto, Ontario. Sunnybrook began as a hospital for Canadian veterans, and our organization grew into a fully affiliated teaching hospital of the University of Toronto to meet the needs of our community. Today, we have over 1.3 million patients visit each year, and we have over 12,000 staff across 3 campuses. So a little bit about myself. Dale shared a lot about what I do, my current role, but I did want to talk about my beehive story.
Yes,
So
please.
this all started a couple of years ago. Like I said in in the introduction, I joined a workshop to learn about urban beekeeping, and I thought it was really fascinating. And it really sparked an idea for me and a question, which I brought towards Mike, and I asked him, like, why don't we have such bees at Sunnybrook? We have such a large campus, lots of green space. It's a perfect place for us to house honeybees. And so I asked the question, then we kind of had a couple of casual discussions, and that led into a lot more formal discussions. And we ended up bringing honeybees to Sunnybrook. It's been a couple years, and we were able to engage a ton of staff in this initiative. We ended up actually creating our own honey and sold it at our gift shop. And it was a really great product that we had at Sunnybrook. And I saw the passion and the joy that it brought with this project. And I that was really the spark for all the sustainability work. I think after that, it was really just passion that continued my journey. And I really wanted to find ways on how I can integrate sustainability into my quality improvement job. So I would say that around the time that I was thinking about the bees, our team was creating our quality strategic plan, and sustainability was floated as an idea or a pillar for our plan. And so I wanted to learn a little bit more, and I took a course to learn about sustainable QI and some of the frameworks that are a part of that. And I think our initial idea was to include existing resource stewardship projects into our sustainability plan for quality. And it was really around choosing wisely and what we can do to help with deprescribing and inappropriate care. With some of what I learned with sustainable QI through the University of Toronto, we started to incorporate more of the environmental impact or environmental components of it. And so as we implemented sustainability within quality, it's evolved from resource stewardship into something that has more of a planetary aspect to it, which I think is like it's a really cool idea and I think unique to many hospitals.
Wonderful. Very inspiring. Thank you, Jenny. Who'd like to go next?
Sure. I'll go next, Dale. Thanks for the intro. I think you'll hear there's some common themes between Mike's story and mine and Jenny's. I think we all have a love for bees in common. My family actually kept bees on our property when I was growing up, and I think that probably started a lot of my concern for the environment and for just being good stewards of the property or the land that we have or the resources that we have. Um, and so for through most of my life and in my family's life, the decisions that we made about where we were going to live and what kind of a house we were going to live in and how we commute to work. I ride my bike as often as possible, and those things were sort of easy to see. This is what I can do in the space that I'm in. But for me, as a family doctor working in a hospital setting, it was not really obvious how I could contribute to making the planet a better place in my place of work.
Hmm.
And so it really wasn't until I think it was December 2021 or sometime in the fall of 2021 when oh, maybe it might have been earlier than that. It might have been 2020. Um, I I became involved in this group of family doctors at the university um, that were concerned about climate change. And
Hmm.
I learned during one of our sessions together about the impact of these inhalers that we prescribe all the time, metered dose inhalers. We use them for asthma, we use them for other chronic lung diseases. And I had no idea that something that I prescribe would have such an outsized negative impact on greenhouse gas emissions. And there are options. Patients could use other kinds of inhaled medications. And that conversation for me sparked other conversations. So I started to talk to some of the pharmacists that I work with and some of the other family doctors that I work with. And I asked if they had heard about this. And none of them had. And so again, just so we started a little working group to see could we change the way we practice? Could we change the way we prescribe? And this sparked many other conversations. And we started to do some work on this, started to try and see if we could change how we do things. And it grew into a project that involved not just the Department of Family Medicine, but internal medicine in acute care and internal medicine specialists who specialize in lung medicine, respirologists,
Mm-hmm.
in their outpatient practice, and family medicine clinics in the community. And so it just sort of snowballed almost. And in the middle of that, somewhere along the way, I took a workshop series on sustainable healthcare,
Mm-hmm.
and my sister took the same one. She's an architect, different profession, and she met Mike at that workshop series, and she said, "Hey, you should connect with Mike. He works at Sunnybrook." And so I reached out to Mike, and we just, again, just had a conversation. And so, it's been sort of it's been a really interesting journey of just starting to talk about things and finding other people that are interested, and finding that there are more people that are interested and concerned and want to do stuff and want to work together. So that's sort of been my journey on how I've got involved with all this stuff with Mike and Jenny, and just started with conversations.
Neat. Very,
Yeah.
thank you. So over to you, Mike.
My journey began way back. I was a child of the 70s, lived through the oil shocks.
Mm-hmm.
And I could see on TV the lineups at gas stations. I heard about increasing energy prices. And I quickly came to realize just how critical to modern society our energy use was. And so um, I've been interested in energy ever since then. And um, I grew up in a household where the sort of depression era mentality of waste not, want not
Mm-hmm.
still persisted. And I could see that there was a lot of waste in how we used energy. And so that's how I started. And then over time, my involvement with energy gradually progressed into some of the other impacts, into green buildings and associated greenhouse gas emissions and health impacts and material choices. I'm actually fairly new to the healthcare setting, eight and a half years already, but a fraction of my career. But I'm still learning so much in this space. But yeah, very much focused on the sustainability piece now. And oh, my bee start with bees came. We had bees on the farm when I was growing up, and so I've always appreciated them as kind of a bellwether mascot, sort of for the environment. And it's funny. It's opened a lot of doors here. Started a lot of conversations at Sunnybrook, and that's as Susan alluded to. That's where it all starts. Is starting those conversations, and it's certainly helped grease the wheels when I'm in at senior management asking for something, and then I say, "Oh, and by the way, I've got some Sunnybrook honey here for you today." It helps me get to yes faster from senior management. So they're a great uh, opening initiative. Let's say it was a good early win for us.
It's a great story. So yes, honey does open a lot of doors, and you certainly speak to my heart. I love my honey, and I have my own little pollinating garden as part of our home here as well, just to bring more bees into our environment. So yeah, so I think we all have that in common, which is great. Um, so, I guess, at the outset here, you've all provided a wonderful sort of backdrop in terms of your passions and what's brought you in here. And I certainly hear, a lot of common threads in terms of your own curiosities and your desire, I guess, about how you grew awareness. And that's ultimately what we're trying to do through the podcast itself. So maybe building on your own individual stories, Jenny, could you share with our listeners, I mean, how did the Green Task Force come to be and its own journey over the past few years?
Yeah, so maybe I'll take us back into history for a moment. We'll start in 2020. So this was right after the murder of George Floyd, our CEO, struck the President's Anti-Racism Task Force to address racism within healthcare. This task force was really successful, led to quite a lot of tangible and visible results. And over time, it evolved into a Department of Equity and Social Accountability. So looking at that model is highly successful. And then in 2022, our CEO had a very similar vision for sustainability and struck the Green Task Force. We knew that Canadian healthcare sector contributes towards 5% of Canada's greenhouse gas emissions, and he knew that we needed to take action. So our Green Task Force was, I think we launched it around Earth Day in 2022. We put out a call for members, and we were very surprised. We had over 80 applicants when we first launched, and we knew that there was so much energy and passion that we had to focus and choose our team quite wisely. What we had to do, we would obviously wanted to have all 85 on our task force, but we knew in order to have tangible and actionable results, we had to narrow it down. So we narrowed it down to about 15 members with the 3 of us as co-chairs. And the 15 members that we chose were from different leadership levels, different roles, and came from with different expertise. We have people on our membership that come from infection control, environmental services. We have clinicians like nurses and doctors and project managers, because we know that's really important for their expertise as well. As we got our team going, we knew that we wanted to include the voice of our community. So we engaged community members. We have 3 community members with our team now who are able to support us and provide perspectives from a very different lens and provide us the patient aspect of, and also how do we engage the community when we are looking at some of our initiatives. So I would say it's a very successful model. When we started the group, everybody came with passion and ideas, and we had so many ideas on what we can do to implement change at Sunnybrook. Again, we had to be actionable, so we created a framework to guide our thinking and to prioritize some of these initiatives that we want to implement. What we created was the GROW framework, and GROW, we'll start with the Green Buildings and Grounds as our G. This is a group of our members who are really interested in looking at opportunities to integrate sustainability into our buildings and grounds. One of the first things that they did was looking at documenting all the gardens and sculptures on our campus. We know that there is a link between wellness and sustainability and time outdoors. And so we wanted to have a little bit of a discovery guide and give our staff an opportunity to step outside, explore the grounds during the workday. So that's something that we implemented. And we've also really encouraged our teams to have the discussion and start those questions on what we can do to have more sustainable buildings. We know that in healthcare, especially at Sunnybrook, we're building quite a lot of new buildings to support the needs of our community. And thinking about sustainable design was something that was top priority for our team. So that's something that we've been starting the discussion on. Our next priority area is research, education, and culture. We know that there needs to be significant behavior change to move towards sustainable practices. So we have been partnering with University of Toronto colleagues to develop education modules. What we're hoping to do is launch education modules so that everybody at Sunnybrook, when they're onboarded, will have a little bit of education on what sustainability is and what they can do to implement change. Next group, our next stream of work is clinical operations, which is the O and GROW. So we know that traditionally a lot of sustainability projects were led by facilities and plant operations. We knew that in order to have more buy-in and more impact, we needed to spread that beyond facilities. So we started looking at what we can do in clinical practice. This group focused on things like what Susan was looking at, the inhalers, looking at anesthetic gases with large impact on the organization, and strategies to either reduce or maybe stop usage of these gases to reduce our impact on the environment. Other things that they're looking at is opportunities to reduce overuse of examination gloves. Or lastly, we have our group on waste and procurement. I think most people think about, when they think about sustainability, they think about waste, but we know that the root of waste is in purchasing. So we had to focus on procurement. In this stream of work, our members are looking at strategies to optimize waste streams and opportunities to divert waste from landfill. One of the first things that they implemented was looking at recycling bins and staff lounge. They also asked a question to say, why aren't we recycling more? And when they dug into it a little bit more deeper, they realized that staff who wanted to recycle couldn't recycle because there's no recycling bins in their staff lounges. So they implemented an organization-wide initiative, and now all of our staff lounges have recycling. As part of their efforts, they've also looked at water refill stations. So we know that we want to shift away from single-use water bottles. And so we created a little bit of a communication campaign. And through that campaign, we've actually increased and installed more water refill stations to support change towards sustainability. So lots of great initiatives, but that is our journey with the task force so far.
Wow. Yeah. Well, you've shared a lot with us so far in terms of all the incredible initiatives, as you said, that Sunnybrook has undertaken. So, I mean, at the backbone of all this, it's obviously all about the people. So, and your own work and backgrounds in this. So, I just curious, like, if I can take the next question over to you, Mike. As you described in your own background at the beginning, how you're relatively new to healthcare yourself, and with your engineering background, you probably stand out, against all these other clinicians as being a little bit different than all the other folks around you. So, I'm wondering, if you, in terms of your own reflections on how your background, complements the work of people like Susan and Jenny and the others on as part of the task force, and how does that work together from your perspective?
Yeah, you may want to ask Susan and Jenny about the challenges of working with an engineer. But in terms of my perspective, it is definitely a interesting and unique space to work in as an engineer.
Hmm.
Um, my decades of work in buildings of various types and with building systems is, I think, helpful to the group. Uh, After all, building energy and emissions is like the second biggest impact category after supply chain.
Yeah.
So it's important. And as Jenny says, there's always construction going on, whether it's renovation or new buildings. And that was certainly one of our top priorities after forming the Green Task Force, was try to evolve how we do projects. And so some of our upcoming proposed capital projects, we're trying to introduce a new way of doing things, a more um, collaborative, forward-looking, life cycle perspective on things, rather than just a sort of a upfront lowest cost, um, get what we need for now, and just focus on price. And so I think, like, I've been involved in dozens of green buildings in the past, so I think that has helped guide our work in that area. Um, so yeah, again, like I say, working in a hospital is interesting. It's a very high energy space compared to other buildings. It's two or three times the energy use on a square foot basis compared to, say, an office building.
Yeah.
So there's lots of potential there. The focus on patient safety is has big implications on how you design the building in terms of redundancy, reliability, lack of tolerance for downtime.
Hmm.
Um, and I guess the other, personally, a challenge, this is a bit of a stereotype around engineers, but for me, it's somewhat true that I've had to really stretch my usual capacity for communication and empathy. My colleagues have certainly helped me out in that area, and as always, a liberal dose of humility helps. I'm not by any stretch leading the show here. I'm very much in a supporting role, and I recognize that, and keen to do whatever I can to help others make a difference.
And I'm just curious in terms of, as comfortable as you're sharing in terms of some of those challenges. I mean, do you face, you know, pushback sometimes that, you don't know because, you're not a clinician or you're not a healthcare person sort of through and through in terms of the ideas that you bring forward in the context in which you all work?
No, I'd say the people I'm working with are recognized, but are very tolerant of my deficiencies in clinical background.
Hmm.
Um, that's what certainly a good factor about working in a healthcare environment is that everybody is very people focused and collaborative and looking for solutions, wanting to do what they can to work towards a solution. Like nobody is happy about steam getting shut off to the facility, but they recognize that sometimes it's necessary and that we all have to work towards making it as painless and as safe as possible. And so no, it's a great group to work with, very collaborative, team oriented.
Thanks, Mike. I appreciate you sharing. So maybe to you, Susan. I mean, we've talked a little bit about the collaboration part of it, but what has been the task force secret to, I guess, engaging with others within your organization and building this momentum for change that you've accomplished over, a relatively short period of time, that's just a couple years?
Yeah, it's a great question, Dale. And boy, do I wish I could say that there was a secret sauce that everybody could use that would work at their organization. And I
Hmm.
don't think there is, but and I think we know that. But I would say a couple of things. One is that we have had the full support, as Jenny said in her introduction about how this all started, the full support from senior leadership. The idea came from our CEO, and we were, for the first couple of years, we met with our CEO every 2 weeks to just provide him updates and keep him in the loop on what we were doing. We're now meeting with one of our other VPs. So that's been huge, having the support of our CEO right from the get go. And then, I think Mike does himself a little bit of a disservice, but we don't have to put up with him. We all get along actually quite well, and I think that's definitely something that is a strength. Within the three of us as co-chairs, we all have different areas of expertise and different strengths, and they complement each other.
Hmm.
And we've grown to be able to to challenge each other, to hear each other's ideas, and it's been a really great collaborative group, just the three of us. And then within our wider task force, similarly, we have a great bunch of passionate people, and I guess that's the third thing that I would say is having a group of passionate people who are willing to keep on working on things, because it matters, even when there are roadblocks. And if I could give an example and give a shout out to one of our task force members, Danette Beechnor, who
Great.
is in charge of our pharmacies. And so she has been spearheading the work that we've been doing to eliminate waste of nitrous oxide, which is an anesthetic gas. It's otherwise known as laughing gas.
Hmm.
And we have it piped through our buildings. Unfortunately, when you pipe a gas under pressure through a big building, a lot of it leaks. And so a lot of that gas, even though, we keep refilling the tank, it's not actually getting to the patient. It's just being vented into the atmosphere because it's leaking.
Hmm.
And Danette, it's been over a year and a half since we started this project to just, get rid of the waste, not change the way people do things, just get rid of the waste. And there have been lots and lots of roadblocks, lots of challenges, and she has just been persistent and has just kept on working on it. She's gathered the right people, got all the stakeholders involved. There's been a lot of meetings, and we've started to see some success. We turned off the piped nitrous oxide at our orthopedic surgical center at the end of May, and we're now working on hopefully doing the same here at our main site. So support from senior leadership, complementary gifts and abilities amongst your team, and passionate people. I think those would be three things that I would highlight to say, um, yeah, those have been key to our success and momentum.
Great, thank you. That's great. Three sort of lessons for others to sort of build on.
And
Um,
can I just add, Dale, that
yeah,
if people, individuals, they want to do more. They want to be able to address the sustainability challenges, but often they're stymied. They don't know who to talk to or how to
yeah,
get approvals or
Yeah.
other resources. And that is what the task force is meant to do, is try and remove those roadblocks and get those approvals and connect people. We're not necessarily doing the work, but we're enabling the work. And I think that's where the success is. If you have that enabling framework in place, people want to do this. They want to make change, be an agent of change, and that's what we're trying to do.
yeah. Well, I think what you're describing, through those examples is, and what you've just shared, Mike, is really, it's the role of leadership as a whole, right? It's to try and, create spaces for, others to be successful, remove the roadblocks, harness the best in people, and allow them to be, to make their contributions. And I think, as you're saying, is there's, we're surrounded in our society by a lot of people who would like to take action but just don't know how. And so I think it's commendable in terms of what you're doing, and harnessing that energy and giving people I guess, a conduit in terms of how to express that. Um, and I guess building on also the strengths-based approach that you've been describing as well, Susan. I mean, you all complement each other and bring those same attributes. And it reminds me of another podcast I was listening to, where the person just said, you have to lead from your own strengths. I mean, make your contributions based on what you bring to the table. Um, don't have to be what you're not, but we all bring those same attributes. So maybe building on that, Jenny, your own sort of QI background, it's how does that complement the work that is being brought forward? I know that Dr. Husein Moloo talked about his own QI sort of perspective on that, but maybe you could dig into that a bit deeper from your own perspective.
Yeah, I think that using QI to advance sustainability is it's a great way, it's a great approach, I would say. For those who aren't familiar with quality improvement, it really is an iterative process. We follow the model for improvement, where you start small, think about the root of the problem, you think about how you measure it, and then you do your PDSAs, your plan, do, study, act cycles. And those are meant for you to do small changes, and over time, those small changes will lead to big change. And so I think when we started the task force, I thought about it from a QI perspective to see, how do we make this big problem less overwhelming for our teams. We found that when we started our projects, people didn't know where to start. It was such a complex problem that we really had to talk about it and scope it and think about what small change that we can make. And I think using the PDSA cycles and having that frame of mind where you're looking at like an iterative process, an opportunity for us to learn from each change that we make, really does help us learn from the process, learn from the experience, and build that confidence that we can continue to make change. So I really think that the QI framework is very helpful. Also thinking about change management, we know that this is a change for a lot of people. Sometimes when we are looking at sustainability initiatives, we're asking people to shift away from single-use devices to reusable devices. You may think that, well, it's the same device, like it's doing the job, isn't that enough? But it's not. There are a lot of complexities with that and changes with how we work. And so taking that into consideration and thinking about change management is really helpful for us to design processes and design initiatives so that when we do implement it, it isn't overwhelming and staff are able to adopt it and accept it, and really like use the products that we're providing them or the alternatives that we're providing for them. So I really think QI is really helpful. I think that when I think about QI and sustainability, a quote comes to mind. I don't remember who has said this, but I hear it a lot, and it's the quote is, "Not every change is important, but every improvement requires a change." And I think about that all the time, and I teach that when I do my QI teaching. I really think it's applicable to sustainability, because I think that it's such an emerging field right now. Not everybody knows where it's going. There's always new products coming out and new thinking that we need to apply for sustainability. And so it really is a reminder that we need to keep, keep thinking, keep making change, know that it's not every change that we implement isn't going to be perfect, but it's the learnings that we have through that process that will help us get to where we need to go. And we just have to always think, make what small change we can make by next week. And I think that's going to get us along our journey for sustainability and really push us forward.
Thanks, Jenny. So I guess part of what you were saying as well just got me thinking, so how do you measure that as well? So, I guess from the QI perspective, I mean, and these changes that you're making within your organization, I mean, what are the indicators of your success or of success of a planetary health change initiative?
That's a really good question. I think we're always talking about this. I would say that because we're still in the infancy of our task force, a lot of what we're measuring is, I would say it's complete versus not complete. So it's building the task force, building the foundations, building the relationships to enable our projects. That has been the foundations for measurement. We've seen so much change in the past couple of years. We've seen growth. What we started off with the 15 members of our green task force, we've grown, and we've also seen lots of movement, lots of little local green teams popping up, which I think is a measure of success. We've seen people engage with us in sustainability discussions, people reaching out to us directly to ask us, what do you think about this? Or like, have you thought about this product? And I think it's the conversations that we're having. It's challenging for us to measure that type of engagement, but we do see that in the events that we host. So every year, our Green Task Force hosts a number of events. We have our Waste Reduction Week event, we have our Earth Day week activities, and we do see a lot of staff come by, and we can measure how many people come by, register for a game that we're hosting or a prize that we're doing or a webinar that we're doing, and we can measure the amount of people that are coming through as I guess as a proxy for engagement. And so right now, that's kind of what we're working on for measurement. We do have plans to continue to measure. We are looking to do energy audits to see where we are and how we can find opportunities. Looking at waste, we've been measuring a lot of waste in terms of volumes and weight of waste, but we haven't really looked at how that compares to our overall waste audit every year that the organization does, and how our impact how our strategies are impacting that report, or whether we are choosing the right streams or areas of focus for waste. So I think there's a lot that we can do for measurement, but because it took us a while to build those relationships and build that engagement, so far we've been measuring mostly on what I described earlier.
Yeah, for sure. And it's a great place to start. But yeah, I think it'll be interesting to sort of hear as you continue on this journey about what some of those impacts are on things like your waste and your energy. Which I guess, brings me to come back to you, Mike, a little bit in terms of, in so many parts of the business that we talk about the importance of good design. I think you sort of mentioned it as well in a few questions ago, and how you accomplish this. So, what is that role of design in addressing planetary health, and in particular in existing infrastructure, as you're not building a new hospital, you are in a hospital that's been around for decades, and you're trying to make it do something it perhaps wasn't really designed to do. So, what are your perspectives on that?
Yeah, we definitely know about aging infrastructure. Some of our hospital dates back just post-war, and we are dealing with those impacts every day. But in terms of new infrastructure, like say buildings, for instance, just to simplify, yeah, there's a lot we can do better on. The traditional approach in designing a building is more or less a sequential process where the owner, that would be us, sets out what kind of spaces we want. And then an architect will design a building to accommodate those spaces. And then the engineers will design the systems that'll fit inside the architect's box. And then the contractor will just build what he's told. And this works okay. It may even have a lowest upfront cost, but it's often not an optimal solution, not the most efficient, not the lowest life cycle cost, and it's less likely to be really innovative.
Hmm.
So a better way to do it is an iterative process that loops back on itself and involves all the stakeholders right from the start. So um, the the everybody's sitting around a big table to talk about the different design possibilities, and it's a way to um, fully tap into everybody's expertise up front rather than them having to sort of fit the mold later on down the line when a lot of the doors have already closed.
Hmm.
And any it gives a chance to address any constraints or concerns that others in the team have if something is proposed. The earlier you do it in the process, the cheaper it is.
Yeah.
Uh, so one example, we have a wonderful tool called an energy model. It's basically just a software representation of any proposed building and how it's going to operate, especially when it comes to energy. This is often just used as a check after the building's designed to make sure it meets code.
Hmm.
Um, like the code maximum energy or minimum or energy requirements thresholds. Much better if you can use it as an actual tool to try and do better. I mean, code, after all, is just your bare minimum. That's the bare minimum expectation. I think these days we should be striving for better than that. And the energy model is a great way of testing out different scenarios at very low cost early in the process. So one of the early green building frameworks, LEED, that's LEED, Leadership in Energy and Environmental Design, I think set it out very well early on. It's got that iterative process built into it. And it addresses many different aspects of sustainability, like energy and water use and indoor air quality and occupant health and material selection. And it gives the team flexibility, the design team flexibility in terms of how much weight they put towards each of those and which is most important to them. And equally important, or maybe more important, is there's a fairly rigorous documentation process. So it's not just people saying that they're green, it's they have to prove that they're doing what they've said through this documentation process with third-party review. And I think we need to do a lot more of these things, iterative design, and the actual documentation to keep everybody on the same track through the process, and better use of the tools we've got to facilitate the process. And so back to your question about existing infrastructure, that's a tough one. The building you've already got is often the lowest impact, and in a lot of cases, building new, it's going to take decades to make up that new construction impact. So in many cases, it might be better to do a deep retrofit, or deep um, conversion of the space, and reusing the existing materials rather than bulldoze the whole thing and start from scratch.
For sure. That makes sense. And it just, well, Susan's answer previously got me thinking, and I was going to ask you, and you sort of have made some references to code as well. So forgive me if I take us down to a small rabbit hole, but my father, his early career started as a plumber and a pipe fitter, and so um, and he did work in hospitals, putting in metagas lines amongst other things. And so I'm curious about the role of building codes in building things like why does a nitrous oxide pipeline leak? Why don't we build it so it doesn't leak? And is that impossible, or is that just because the economics of it? It's like, when those building codes were created, it's like it didn't matter because it was just nitrous oxide. It we didn't really care about it. Whereas we pressure tested all our water lines or sewer lines because that was important. But I don't know what are your thoughts on that, Mike?
Well, in general, code is a bare minimum standard. Good design these days, you should be looking at additional frameworks to get you above and beyond. So in Toronto, that'd be the Toronto Green Standard, and not just the basic level, but upper tier levels. Um, I have been encouraging our design team to, with this energy model, to have net zero as one of the scenarios, be
Hmm.
that net zero energy or net zero carbon. I know that's a real stretch for an acute care trauma hospital at this point, but there are facilities being built that are, and healthcare facilities too, that are being built to net zero standards. And so it is doable. Um, so that, I think, is what the design teams need to do, is to look at what else is out there and consider like meeting code is not sufficient these days. It is a lagging indicator. We have to be looking to leading indicators these days.
Thanks, Mike. Appreciate that. So, Susan, so bringing this back to why healthcare is all why it's here, right? It's about patient care, patients, people. How does the work that you're doing in terms of planetary health relate to patient care?
Hmm. Great question. So, um, I recall somebody brought to my attention a few years back. There was a piece in the Toronto Star, and the headline was "Healthcare Harms as It Heals."
Hmm.
And I think that really drives home that point. And you were talking about this with Dr. Moloo last time as well, that healthcare is a contributor to greenhouse gas emissions, and those greenhouse gases contribute to global warming, and global warming is what's messing up everything. And so we have to recognize that we are contributors as healthcare. And I think Dr. Moloo pointed out that really, um, globally, there are only 4 countries in the world that contribute more in terms of greenhouse gases. And so, if healthcare was a country, we would be fifth in terms of our contribution to greenhouse gases. So, okay, well, what does that mean when it comes to the patients and the people that we look after? I mean, I think we are seeing people coming coming into our care with uh, problems that are related to the warming planet.
Hmm.
Um, we could look at an extreme example like the heat dome in BC a few years ago, and the impact that that had on, just the sheer number of people that needed health care because of the extreme heat. The wait times for an ambulance were in the order of, 13 hours, which should never happen. But also on the flip side, the impact that that had on the ability of healthcare to provide care. There were whole facilities that lost power, and so they were unable to provide critical care services because of this extreme heat event. And so, I think we have to recognize that we are contributors.
Hmm.
We are also looking after the people that are impacted by all of this, and so, I think that it creates an almost a moral responsibility to do things better. And we talk a lot about, when we're thinking about things that we want to change, and we want to do this better. So, for example, that nitrous oxide project that I was talking about, and just eliminating the waste.
Hmm.
Well, can we do that without um, impacting the quality of care that we provide? because of course we don't want to compromise the quality of care that we provide. We still want to provide excellent health care. So all of these things are related. So if I was, I had to give that one liner, I think I'd go back to that headline and say, well, healthcare is harming as it heals. So how can we do this in a way that allows us to provide healthcare, but it reduces the impact, it reduces the harm that we're causing? And so that's what we're trying to accomplish as a green task force.
Yeah, so there's a bit of a balancing and I guess a check and balances, I guess, in some of that, even coming to some of the examples that you had provided, Jenny, around right I guess the single-use devices, or I think you mentioned about using gloves where they weren't necessary and things like that. So, obviously gloves are being used to protect patients and and staff as well. But so what is the trade-off, I guess, in terms of reducing some of those things?
Yeah, exactly. I mean, I think yeah, we are looking at some just engineering controls, just to again reduce the waste from gloves. If every time you take one glove out of the glove box, 5 of them fall out and land on the floor, and you have to throw them out. Well, you know,
Yeah,
that's, so maybe there's something that we can do that would just eliminate that waste. But then, as Jenny mentioned, like there are times when maybe we don't need to be wearing a glove. If you're just checking somebody's blood pressure, you probably don't need to be wearing gloves. There are other procedures where you absolutely do need to wear gloves, and you do that for the patient's safety and for your safety and all of that. But yeah, all of this is there's definitely culture change. People become very used to doing things in a particular way, and they think it's the right way to do it for those reasons. And so some of this is just rethinking, why are we doing what we're doing, and is this really the best way to do it?
yeah. Thank you. Were you going to add something to that,
Nope.
Mike? Or
Well, I just want to emphasize that it's not necessarily, this isn't necessarily taking away from care. Generally, it's supportive. It improves patient care and the patient experience. Um, doing this well. You're usually not taking away. You're supporting and in alignment with all the other objectives in a healthcare setting.
Yeah, I would totally agree with that, Mike. And I mean, just in terms of like, for the example of the gloves, patients, when you ask them what their experience is like, if they are cared for by somebody who's wearing gloves versus somebody who's not, they actually prefer the person that's caring for them not to be wearing gloves. They prefer to be able to have a real human touch. And so, as I said, obviously there are times and places where you must, but so it isn't, as Mike said, it's not taking away from care. It's actually being quite patient centered, and acting in a way that provides the best care that we can.
and I guess what I may reflect on some of what you just shared, Susan, is that I guess you're taking, I guess, at a micro level, a care example or where care is being delivered, but situating it within a larger ecosystem, if I can play on words there, right within the context that the use of that glove is part of a larger, has planetary health um,
Hmm.
impacts that will also come back to that same patient eventually. And so it's not just, I guess, some of what you've been talking about, Mike, as well, but it's not just lowest common cost in a certain instant, but looking at that cost in a more macro level.
Yep,
Yeah,
that's
I would
true.
agree. Our IPNC team, just continuing on the theme of the gloves, they've kind of looked at the impact, the greenhouse gas equivalent of the manufacture and use of one glove versus washing your hands,
Hmm.
and it is orders of magnitude more for that one glove compared to washing your hands. So yeah, it's about looking at all of these things, and Mike has made reference to life cycle a couple of times. So that's part of what we're trying to do. It's really hard to measure. And this is part of the challenge. Some of the challenges that we have is, how do you, and you made reference to it as well. How do you measure success, and how do we measure impact on the environment? So we can measure, the weight of the garbage, but that doesn't tell us about all the other impact that all those gloves that are in there had. There was a cost, a greenhouse gas cost to manufacturing it, and then there's a gas cost to its being decomposed, and then everything in between. Um, and so it's starting to take into consideration not just the financial cost, but the greenhouse gas cost, the time cost, all of these things together. That's sort of part of what we're trying to do.
Yeah, well, it is a systems view, I guess, right?
Yeah.
So, um, you know, I'm sure we could talk for hours or days in terms of the many successes that you've had so far. Um, but in your view, what has been to date, right? The key to the success of the Green Task Force. Anybody?
I think it's the people, it's the passion that people have and the ideas they bring forward and the time they contribute. I don't think we've mentioned it, but all of our task force members are volunteering. So everything that we've accomplished so far is what they do on the side of their desk. And I think that's what I'm proud of. And I think that's also what drives a lot of their passion and interest in sustainability. So I think that it's definitely passion, people and passion.
And unfortunately, some of the we spent many decades debating with people about climate change. I think we're starting to see it manifest now, and that argument has more or less gone by the wayside about whether it's a real thing. And so that, unfortunately, is also a driver for things happening faster now. And there are more discussions happening out in industry, and the formation of a national organization in the healthcare sustainability space with Cascades,
Hmm.
and at our local Toronto level with the TASN group of hospitals starting to include a stream on sustainability. That really helps to spark the conversations, and comparisons are useful too. Scorecarding exercises have been very useful. If 4 out of 5 hospitals are doing something and you're not, well, why aren't you? That's a great incentive.
That's great examples. So thank you. Um, so I mean, throughout the conversation, you've all made, I think, very strong points for the importance of leadership and the vision of the executive leaders. You've all sort of have called out Dr. Andy Smith in terms of his leadership as a CEO at Sunnybrook. So where does your strategic plan fit into this? Or how does this fit into your strategic plan? I mean, how does this, and even at I guess at a more meso level, I mean, how does this show up as part of the strategic plan in each of your departments, or others across the organization?
I guess I could start here. So I'll start with I mentioned it already, the quality strategic plan. We do have sustainability on there, and because it is a goal as a priority for quality, it does. We do see sustainability in our annual QIPs, which is our quality improvement plan. So
Hmm.
we've seen in the past couple of years initiatives that have planetary impact on our quality improvement plans. So one year we had we had the nitrous oxide project where we looked at reducing leaks in the system and reducing use of nitrous oxide. One year we had a project looking at medical supply wastage. So as most people know, when patients are admitted to the hospital, quite a lot of medical supplies are at the bedside. When they go home and they're discharged, all of that goes into the waste. And so we put in some processes to reduce that amount of waste. And most recently, this year's quality improvement plan, we put in heat planning as one of our priorities. We do know that we have a community that we serve and that there are opportunities for us to coordinate our approach to heat response. And so that is something that we are working on. We've recognized that we need to elevate sustainability in our corporate strategic plan. So we've been working with our partners, and I've mentioned our Department of Equity and Social Accountability. We've partnered with them, and we are creating a joint, probably, I don't know if it's spoiler alert, but we are looking at a joint collaboration so we can have sustainability and social accountability as an enabler in our corporate strategic plan. And so I think you'll see themes and threads of that through our corporate strategic plan. So maybe before I continue to spew more of our secrets, more to come on that. But I do think that there will be a lot more elevation, a lot more visibility with sustainability in our strategic planning going forward.
You're here
we
to
are
spill your
having
secrets. So
we are having those discussions with at the department level in their strategic plans as well. So those are good conversations.
Yep.
Lot more.
There were a couple of people, a couple of groups that had already started to include sustainability in their strategic planning exercises, and they were codified in their strategic plans. But since the Green Task Force has formed, we as co-chairs have been invited to the table for the ongoing discussions at different departmental levels. So that's really exciting, just to be able to brainstorm with people about how they might think about what they're doing and how they can do it in a more sustainable way.
So I think one of the burning questions that some of our listeners are going to certainly have is about how do we or how do they take the lessons that you've been sharing here and do something the same. If they're one of those one out of five organizations that hasn't taken action in this place or wants to expand their action, how do they do so? And I think probably more importantly, because I think you alluded to this, Genny, in terms of the power of the people, that many of you are doing this off the corner of your desk, right? So, where do the resources come from this to make this happen? If others going to walk in your footsteps, how are they going to do that?
It helps to have support from executive leadership, doors open. Yeah, very much. We're except for me, we're volunteers, and there is no dedicated resourcing yet. But since our task force spans the organization, we do have sort of access to different pools of funding, and so we've been okay so far, and we've in fact been able to get some outside funding, some external funding as well. And so we've been able to make do. But yeah, in the long run, as we ramp up further and government, like outside policy and funding streams become available, we'll make more use of those.
And I would say too, people may not be in a situation where they have strong support from senior leadership at this point. I mean, who knows, whether that will continue, as Mike said. If most other hospitals are moving in this direction, it's unlikely that everybody is that the holdouts are going to stay that way. But if you are in a situation where you just don't think that you've got buy-in from senior leaders, I would still say, start the conversation. Start talking to the people that are around you, and talk about stuff that you're concerned about. And because the reality is that there are so many things that we have in common that concern us. We have families, we have people in our lives that we're concerned about, and global warming is impacting them in some way or other. If I'm concerned about it, probably somebody else is concerned about their family too. And so start with things that you have in common. Start having the conversation. Start just, saying, hey, have you noticed how much, whatever, it could be the plastic waste or whatever. And doesn't it bug you? You would be surprised to find how many other people there are that are also interested in the same thing and might be willing to try something, to do something about it. I think, one of the climate scientists that we've all kind of read a bit of her work. Her name is Catherine Hayhoe. She's a climate scientist down in the States, although she's Canadian. And one of the things that she says is one of the most important things that any one of us can do to help combat climate change is to talk about it.
Hmm.
So I think, if you're in that situation where you're working in a facility where there really just doesn't seem to be buy-in from the senior leaders, but you start talking about it and you find some other people and you start doing some stuff, it'll start to get noticed. And then over time, it, things are going to start to change. So, don't be discouraged. Just keep on keeping on.
I agree. It's the having the conversations and asking those questions. It's Mike, I mentioned it earlier, people don't know who to ask questions. If they have an idea or a question, they don't know where to raise it. It's creating those opportunities. So I think as a leader, we have to create those opportunities for people to raise their ideas, raise their questions, and be able to express some of their concerns. Because I think when people think about healthcare, they're really stuck into patient care. This is what I'm doing for a patient. And giving them the opportunity to think a little bit outside of the box of think bigger. What can we do from a sustainability perspective that will also impact our patients? It gives them a moment to pause and it gives them a moment to think, oh, I've noticed this in my practice. And I think we can like make a change based on my experience. I don't think that if I don't think that those ideas are raised unless we give them an opportunity or a voice to raise them. So I think as leaders, it's crucial for us to create those moments.
That's great.
And look for allied groups in the hospital too. Like I'm on the energy side. We've had a presence at Sunnybrook for over a decade. And a lot of what we do is around money. So there might be resources there, or at least the start of a network there. Or is there a staff wellness committee that comes into it, or an occupational health and safety committee? Of course, there's one of those. There are connections there.
Mhm.
Or as we've mentioned several times, our connections with the EDI folks, the equity and diversity, has been very helpful as well. So connect with those groups.
Great. Thank you. It's a great advice for people can get started and build some momentum. So I guess one of my questions, and do you fear or have you discussed like that? I guess, as much as you've been this great success so far, that you're just a flash in the pan, right? That your momentum will die off, or how do you talk about how do you sustain the work that you're doing and grow it even beyond that, and keep people energized?
Climate change isn't going away, Dale. And people know this.
Yeah.
So yeah, I think we'll certainly evolve over time, but I think we've got a good framework to build on and to grow from.
Mhm. And I think we have been inspired as well by looking at some other organizations that have been doing this kind of work much, much longer than we have.
Mhm.
There's like the Cleveland clinics down in the States. Um, we chatted with one of their guys from there, and they've got decades of experience, and he just encouraged us, things that get people's attention, that the sort of low hanging fruit are things like garbage and waste and stuff like that. So it's not that impactful necessarily, but it gets people engaged. So start there. Just, and so sort of seeing people that have been doing this kind of work for the long haul and started small and saw small successes and just kept building on them, that I think we found to be encouraging. Even when, yes, there are challenges, we've run against roadblocks and things like that, and but uh, other people have been doing this for a lot longer than we have. So um, we have encouragement to persist.
Great. Thank you.
And I think
Uh,
also people stop engaging with you when they meet barriers or resistance. And the whole, like our Green Task Force is meant to break down some of those barriers and help make things possible. So I think as long as the task force is around to break down those barriers, I think people will continue to engage and continue to have the conversations. So I don't worry about lack of engagement because I think that people will continue to bring their ideas forward.
especially amongst the younger cohort. We have good representation from younger folks on our task force, and they are really keen. I'm really
Mhm.
worried about my job, and that's a good sign.
That's it's a good metric for sure. People wanting to take your chair.
Yep.
Um, but uh, but yeah, I think your point is a really good one, Jenny. I mean, I think apathy probably happens when they don't see progress or work getting done. But I think as long as you are removing those barriers and allowing for those successes to happen, then it will probably continue to feed that flywheel, and the momentum will continue to grow. So, um, so maybe, as we get ready to close here, what's next for the Green Task Force, and any other final words of wisdom or thoughts as we close? So, who wants to go?
So much to do. Further integrating sustainability into all our business processes.
Mm.
Again, if we can have environmental sustainability as an enabler in strategic plans, then with any luck, we'll be building it into policies and operating procedures and decision making and procurement. So that'll be a big step forward.
I think I agree. I think it's baking into our culture. I think right now it's sustainability is there, our presence is there, but we're not we don't roll off as like the first stakeholder that's called to the table when we're doing projects. I would love to see that being just normal culture when people are thinking about projects, construction, thinking of ideas. It's what is the sustainability impact? What is a life cycle, or what are our sustainable alternatives? Like, I would love to see those questions surface. So baking into
Hmm.
culture is what I would love to see.
Yeah, I think it would be great if every business plan, right, or proposal had to have something in it that sort of referenced that, or right, not just cost, right, but the environmental and social issues as well.
How many times have I heard from Susan? Well, I was walking in the corridor the other day and I saw this ridiculous thing and I was wondering, why are we doing it like that? And if once everybody is doing that, then that'll be fantastic.
Yeah, I think I said at one point in one of our meetings with Andy that we would love to see that um, the idea of sustainability just becomes part of the air that we breathe here at Sunnybrook.
Well, that
Who
that
knows if
is a
that's achievable, but
it's a good
aspirational.
success. Yeah, for sure. So, any other final words from any of you as we close?
I think we just thank you for the opportunity to chat about this. This has been a great conversation.
Yeah, I think Susan wrapped it up nicely with making it the air we breathe. Thanks a lot, Dale. This was a good conversation.
Yeah. Well, thank you, Susan, Mike, Jenny. I thank you, I guess, for your passion and commitment in terms of the work that you're doing at Sunnybrook, but also in terms of your enthusiasm, and to share it with all of our listeners here, and to I think to inspire other leaders in terms of what it takes to mobilize an organization to make a difference like this. I think I think, well, you may not be unique, but I do think you're special for sure. In terms of what's happening, and I think there's probably many organizations in our country and around the world that could learn from you, and hopefully replicate some of this work in their own organizations. So thank you.
Our pleasure.
Thanks, Dale.
Thank you.
Okay, best of luck. You've been listening to the HQ, and I'm Dale Sherbeck, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.